Thank you, Andy. Good afternoon or good morning, good evening again. Hope you're all well and safe. So today's presentation, as Andy said, is removal of residual endotoxin from biopharmaceuticals. Before I go into the main presentation, perhaps I'd like to run through the story of our company. We've been around for a while now. The company started back in 1987 as a spin-out of University of Cambridge Institute of Biotechnology. Since then, we've grown substantially. In 1999, we launched our own agarose-based base matrix. I'm not going to run through all the highlights here. You can see we've been around for a while, but the key thing is that today we have substantial manufacturing capability on our manufacturing site, which is, I'll show you shortly, is on Isle of Man. We supply columns, we supply pre-packed columns, and we supply chromatography adsorbents. We've gone through a number of changes, but as of 2020, we became known as Astria Bioseparations, and that's who we are today. So we're based in Cambridge. Our R&D and site and main offices are based in Cambridge, in United Kingdom. Our manufacturing site is on a small island just there, and located right in the middle of Irish Sea, Isle of Man. Most of you have probably heard of Isle of Man. That's where the TT racing takes place, motorcycle racing. So we've been established for past 30 years, over 30 years. We have an extensive range of bioseparation products. Our primary focus is to develop affinity ligands which are based on small synthetic chemical molecules. We also offer custom development and manufacturing services for chromatography adsorbents and downstream processing. We have capability of manufacturing adsorbents at a very large scale. It's something that we're fairly uniquely positioned. And we manufacture all of our materials to CGMP standards in clean room, and we provide full regulatory support. We have over 18 of our products in regulated processes across the world, and some of our applications are in very large scale in 2-meter diameter columns. And we also supply semi-disposable and pre-packed GMP-ready process columns. We have a mission. Our mission is to discover, develop, and deliver. And that's a mission we're working to on a daily basis. So Astria Bioseparation is the only bioseparations company to offer not only the ligand discovery, but also adsorbent development services in combination with large-scale manufacture of chromatography adsorbents and production of pre-packed chromatography columns to GMP standards. So that's a very brief introduction to our company, and you can go and look us up on our website. So today, going back to the subject of the seminar, I'm going to talk about endotoxin removal. Endotoxins, or lipopolysaccharides, are highly toxic components of gram-negative bacteria, and they're quite often present in large quantities when one uses extraction systems such as E. coli. I mean, we still use that for recombinant protein production. I think before I leap into how we go about removing these residual endotoxins, it's important to understand a bit more about the general structure of endotoxins. These molecules are polar heteropolysaccharides chain, and they have 3 distinct domains: the O region, the co-oligo part, saccharide part, which is there, and the lipid part. The inner core here is also composed of sugar residues, which are highly phosphorylated. Lipid is generally most conserved, and these are very diverse types of molecules. Diversity of negatively charged groups and hydrophobic character of these molecules means that they can interact with other positively charged substances, and these interactions are via electrostatic interactions and by hydrophobic type interactions. As a consequence of these interactions, removal of endotoxin from biopharmaceuticals is generally considered to be quite difficult to achieve. But we have to ensure that we remove endotoxins because they are highly toxic. And there are requirements. According to Pharmacopoeia, the permitted levels of endotoxin for intravenous products is 5 endotoxin units per kilogram adult per hour, where 1 endotoxin equivalent is approximately equivalent to 0.1 to 0.2 nanograms of endotoxins, very small amounts. Endotoxin, as you're probably aware, is an important issue in biomanufacturing. And the endotoxin contamination of biopharmaceuticals occurs when it is released from the extraction system, for example, if you're using a bacterial extraction system, or introduced by non-sterile conditions. These things happen. Endotoxin removal when endotoxin is associated with macromolecules is quite difficult, as I've mentioned before. A number of downstream processing methods have been adopted for removal of endotoxin based on absorption. And here I'm only focusing on the chromatographic methods. And these are either non-selective or toxic or expensive. Anion exchange chromatography and membrane absorbers are quite often used. They are generally non-selective. Affinity ligands, mostly based on immobilized amino acids, are routinely used. For example, histidine, which is again non-selective. There are several endotoxin binding proteins which have been immobilized, but these tend to be very expensive. Polymyxin B has been used for many, many years, immobilized under chromatography support, but it is toxic and it's subject to ligand leakage. And you'll also see that there's a company who's marketing polylysin immobilized on cellulase-based matrix. Polylysin is derived from fungal fermentation. You have to purify it, make sure it's pure before you can use it. So those are the options. But as I said, Astrea Bioseparation focuses on development of very specific ligands for particular applications. And we do it by a number of different methods. Today, I'm just going to focus on development. One of the techniques that we use, which is called the rational development of ligand. And what we do is look at the structures, non-structures of molecules that we're interested in. And as an example, I'm showing you a structure of LPS molecules. There are 2 LPS molecules interacting with a 12 amino acid peptide. This structure was derived from an NMR. So 1 molecule of peptide is interacting with 2 molecules of LPS. And by examining these sort of structures, we can use computational chemistry and interrogate the structures to give us some clues onto what sort of structures we could use to capture endotoxin or any other molecule in a specific affinity interaction. And we did exactly this with respect to endotoxin, and we developed a chromatography adsorbent based on 3 criteria. It had to be cost effective. We should be able to manufacture it to scale. It had to be non-toxic. We needed it to give us a fairly high performance, that is endotoxin clearance from anything we started off to below 0.1 EU per milligram protein, or to put it the other way, 0.05 EU per mil from range of buffers. And it had to be selective. It should be compatible with a wide range of proteins with very low protein binding. And typically we wanted recoveries of greater than 90% recoveries of the protein. So we developed this adsorbent, and it's now commercially available. It has been available for some time now. Here, just listed some of the properties of the adsorbent. As I mentioned, it's a synthetic chemical ligand. It's proprietary to Astrea Bioseparations. It's immobilized on 6% cross-linked monodisperse agarose beads, our own base matrix. It has a very high dynamic binding capacity, greater than 1 million endotoxin units per mil. Fairly good flow rates. We typically in a 5 ml column that we've tested it, we can easily get 400 centimeters per hour. But we recommend the operational flow rates to be around 100 centimeters per hour, depending on the type of feedstock you're working with. Range of operational pH between 4 and 8, which is generally commonly used range for most of chromatography operations. It's very stable. It can depyrogenate it using sodium hydroxide, and we supply it in, obviously, in preservative. So just coming to some of the properties, and we compared it with other commercially available products designed to remove endotoxin out there in the world. With Toxiclear, we can typically get greater than 98% recovery of protein. We can get fairly good clearance of endotoxin, below 0.06 endotoxin units per milligram protein, which is actually below the limit of detection for many of the assays, and typically around about 4 log clearances of endotoxin from the starting material. If you compare that with ion exchange membranes adsorbers that I mentioned earlier on, typically the recovery is around about 84%. Fairly good clearance of endotoxin levels. And then if you look at the affinity endotoxin removal membranes, typically you get reasonable protein recovery. Surprisingly, endotoxin clearance isn't that good, nor at least in our hand. And we've tested this using a neutral solution of human serum albumin, with a spike with endotoxin, 2,000 endotoxin units per mil. But this was then loaded onto a PET column at a flow rate of 1 mil per minute. Again, we've looked at a wide range of proteins across the isoelectric point, ranging from protein that has isoelectric point around pI of 4 up to about 10, 11 for lysozyme. And as you can see, working in a neutral pH, we typically get very good recoveries, typically in excess of 90%. Of course, recoveries are dependent on the pH that you use. In acidic and neutral pHs, we get very good recovery. If you got a fairly high pH, pH 9, then the recoveries of protein do get much lower. And this is simply because the ligand has a slight positive charge. And as you go to fairly high pHs, the protein will have a net negative charge and naturally tends to bind to the adsorbent. But if you work in acidic region or neutral pH region, you should get very good recoveries using Toxiclear. It's all very well looking at model proteins, but we wanted to look at something that was akin to a real life situation. And here's an example of a process that we looked at. It was for the purification of an antibody fragment expressed in E. coli. It was a Fab2 prime 2 antibody fragment, which is on slide here. And we used an adsorbent that we have, Fabsorbent, to purify it directly from the lysate. Fabsorbent is designed to bind to antibody fragments, and you can see the purity is very good. So in the lane 1, we have molecular weight markers. Lane 2 is a lysate. Lane 3 is blank. And that's your purified product after Toxiclear flow-through step. You do get a small amount of breakdown, Fab fragment, but that's not unusual. That's what happens in these types of products. But the purity was good. We were satisfied with the purity that we got. But we needed to look at the endotoxin levels. So as you can see, in a cell lysate, we had around about 190,000 endotoxin units per ml. After the capture step, and fabsorbent works by means of affinity capture of antibody fragments, we were able to reduce that to 46,000 endotoxin units per ml. And then applying the product from the fabsorbent step to a toxic clear column in a flow-through mode, we got the value down to 19 endotoxin units per ml. We were quite puzzled by this at this stage. 19 is still fairly high, but I will come back to this point. This is due to the assay that we were using at that time. But nonetheless, using the process that I've described, that is capture on fabsorbent step, and then using a toxic clear to remove the residual endotoxin, we got a greater than 4 log clearance of endotoxin. Of that, 3.4 log clearance was observed on the toxic clear adsorbent column step. So let's go back to the assay. We looked at why we were seeing such a high value of residual endotoxin. And of course, we, like everybody else, we were using the LAL assay, which is the only assay that's currently approved by FDA for testing endotoxin and parenteral products. The issue here is the specificity of LAL assay is not absolute for endotoxin. LAL reagents react not only with endotoxin, but also with a substance called beta-1,3 glucan, which tend to be present in process streams. And the whole assay cascade is activated by beta-1,3 glucan. And that will affect your end result. You look at the structure of beta-1,3 glucan, there are sugar residues, and if you go back now to the chromatography adsorbents, they're also, of course, based on agar-based matrix, which are composed of sugar residues. And any small amount of these types of molecules present in any sample will affect your LAL outcome of the LAL assay. Recently, many vendors of the LAL assays have realized this fact, and they can now prevent this activation of LAL assay by the glucan by adding a large amount of carboxymethylated codoline. That's another sugar type molecule. And now what we have, there are many commercial assays available which have CMC added to the buffers, and that makes the assay insensitive to any interference by the glucans. And if you use that, those glucoshield buffers is a one that associates of Cape Cod offer, you get entirely different results. And here's some of the results that we obtained when we looked at spike samples in the absence of glucoshield and the presence of glucoshield. I'll come back to the final columns in each of these tables in a minute. And I have two examples here, human serum albumin and IgG. We just wanted to look at different solutions. And then spiking those protein solutions with endotoxin and challenging them with a column of toxic clear. And again, bear in mind, we're looking at the flow-through samples here. So in the absence of glucoshield, our spike sample gave us a result of about 100 EUs per minute. When we looked at the flow-through, the assay gave us a result of 7.9 EUs per minute per milligram protein. That gave us a clearance of 92%, which is not what we expected. But if you look at the results we obtained when we use the assay that contains GlucoShield, we got an entirely different picture, and we got a pretty good clearance, greater than 99%. The similar situation occurs with IgG. Again, we were seeing slightly higher results, so we used external laboratory to test these samples, and we got the analysis done by Lonza. Lonza offer endotoxin analysis. They have a facility based in Belgium, I think. And they analyzed the same samples in their assay, and you can say the results were much better, although the level of clearance is the same as we obtain. So having GlucoShield is a critical factor when you're measuring endotoxin in your samples. I think it's important to bear that in mind when you're implementing either the LAL assay or endotoxin removal step in your processes. We also wanted to see if we could scale up these processes. And here's an example again. We took a protein solution, human IgG, spiked it with endotoxin, and we determined the endotoxin clearance at 2 scale, a 5 ml column and a 780 ml column. Flow rates and 120 centimeters per hour, but the critical factor is to make sure you give it a sufficient residence time. 5 minutes is a good time, contact time to have. So if you look at the results, on a 5 ml column scale, we got very good clearance of the endotoxin in the flow-through fraction, in the non-bound fraction. And when we scale the same solution up, the clearance improved and the recovery improved as well. So it just demonstrates that Etoxiclear can be scaled up quite effectively. It's a flow-through mode, so you tend not to lose any of your target protein. Of course, another potential use of Etoxiclear is to remove any endotoxin that may be present in buffer solutions or solutions that you use in your processes. And here's 3 examples that we looked at. And again, we were able to get endotoxin to very, very low levels. Flow-through mode. Robustness of the adsorbent, it is very robust. Typically, we examine the robustness of our chromatography media by incubating adsorbent at different pHs and then just looking at ligand leakage over a period of time. So you can see any ligand leakage we see is at acid pHs. And over 4 weeks, that's very little, less than 4% or less than 5%. Very small ligand leakage at extremes of pH and alkaline region. The thing to bear in mind here is it's not the chemistry of the ligand that's breaking down, it's the base matrix, the agarose that's been hydrolyzed under acidic conditions. At neutral pHs, right up from pH 4 to pH 13, it's very robust. Hardly any ligand leakage over a period of about a year. So in conclusion, Etoxiclear is a synthetic affinity ligand, adsorbent, and can be used to remove endotoxin from a wide range of biopharmaceuticals across the isolactic point spectrum with very good recoveries of your target protein. It has a very good high endotoxin binding capacity, and it is fully scalable. It shows Etoxiclear has a superior endotoxin clearance compared to many of the products that we've examined in benchmarking studies. And we've used it in real life examples, and we have a lot of customers using them for the real life removal of endotoxins of from a wide variety of their products. To recap, you get 3 to 4 log clearance of endotoxin following capture using an affinity column. It could be affinity column, or it could be an exchanger. So it's designed to use for the polishing step after you've actually carried out your purification. It's used in a flow-through mode, so you don't bind your protein. It's designed to bind specifically to the endotoxin molecules, LPS molecules. And it shows a very good, excellent clearance of endotoxin, right down to less than 0.05 endotoxin units per mil for a range of buffers and solutions used in cell culture applications. The key thing is to use glucose shield containing reagents to ensure that you get positive results and you don't see any interference from the presence of glucans, which are often present in bioprocess solutions. So EtoxClear is available both in slurry on pre-packed columns. It's highly cost effective. It's a synthetic ligand, non-toxic, generally regarded as safe compounds. It has a very high performance and it provides a superior clearance of endotoxin from process solutions and final products. Thank you very much. I'll leave you with our contact details, and I'll be happy to take any questions that you may have.
Thanks very much, Dev. And just to remind you, if you do have any questions, please use the chat function, and we'll try and get to your questions time permitting. I've got a couple of questions that have come through, Dev. First one was really relates back to the title of the talk. Why are you referring to removal of residual endotoxins?
That's a good question. Endotoxin, as I say, are fairly ubiquitous. They're present in a wide variety of solutions, and quite often applying capture steps, be it affinity capture step or any other capture step, you will get some clearance of the bulk endotoxin. The challenge that we have is removal of the trace amounts of endotoxin, especially when it's bound to your target protein or target biomolecule. And this may be very tightly bound. In fact, you may not be even able to detect it using a normal assay conditions. You literally have to disrupt the interaction of endotoxin with the biopharmaceutical. And EtoxClear can do that if you give it sufficient time. So it's removal of the residual endotoxin, which is more challenging rather than removal of the bulk endotoxin that's present in process solutions.
Okay, that's great. And can you use the absorbent in a batch mode?
Very good question, Andy. And yeah, it's a question that we often get asked. The simple answer is yes. Although, bear in mind what I've said before, that interaction of endotoxin with biomolecule is pretty complex. You've got negatively charged groups on the sugar residues, and you have a fairly hydrophobic molecule. So you're almost setting up an equilibrium. So in a bulk, you will have one equilibrium state. If you have the EtoxClear packed in a column, as the sample moves down the column, you're setting up series of equilibria, if you like, and you're shifting the equilibria to bind the endotoxin molecule away from your target protein, if you see what I mean. So you'll get a better performance in a column rather than using it in a bulk mode, but it can be used in both ways.
Okay. The last question I have at the moment is, can you reuse the absorbent?
You can, although we don't provide any specific guidance on this. We conduct depyrogenated with sodium hydroxide. Typically, overnight incubation in 1 molar, 0.5 molar sodium hydroxide solution. You'll have to validate this for your own process. We don't offer any validation support to support you depyrogenating the material, but yeah, you can do it.
Okay, that's all the questions I have for the moment. If there are no other questions, I'd like to thank Dev for a very interesting talk, and thank you all for joining. As I mentioned, this presentation has been recorded, and certainly in the next couple of days, we'll send out a link so you can access the recording of the presentation and also pass it on to any colleagues who couldn't join. So thanks very much, Dev. Thanks everyone for joining, and we'll see you on the next webinar. Thank you.